Okay, whether it's exercising, standing, working, getting around, or feeling confident wearing shorts, we rely on our legs to do heavy lifting every day. But if you or someone you know has leg problems, you'll want to hear what our next guests have to say. Dr. Scott Powell and Dr. Denny Thomas with Texas Vein Experts are here with some insight into circulation problems that you may have and what to do about it. Good morning. So nice to see you both.
Good morning.
All right, Dr. Powell, let's start with you. What are some of the common problems that people have in their legs that you treat?
So the main thing we're treating is what is called venous insufficiency. And this is essentially where the blood vessels are trying to get the blood back to the heart, but because of some valves breaking down, they don't do that efficiently or properly. And so that's what we're really focusing on.
Okay, so Dr. Thomas, how would someone know if they have what you call venous insufficiency? That's right, right?
Yes, it is. So venous insufficiency can be diagnosed with an office ultrasound. Some of the symptoms that patients can experience if they have venous insufficiency is things such as like aching, cramping, heaviness, swelling, burning, itching, and restlessness.
All right, so any of those kinds of symptoms, this is something you might want to check out.
Definitely.
I'm curious, Dr. Powell, is this something that's preventable?
It's not preventable because it's largely due to genetics for women having pregnancy and then work and lifestyle factors that all tend to break down the veins. You can slow it down or relieve some of the symptoms wearing either compression socks, elevating the legs when possible, or some light exercises like walking or swimming tend to help. But overall, it tends to be a progressive disease that once it starts, it just keeps getting worse.
Okay, so then Dr. Thomas, how is it treated?
Yeah, so overall, the treatments are pretty simple. And just like what Dr. Powell mentioned, is at first we like to do a short trial of compression socks. However, if that doesn't work, we can do an in-office procedure where we try to close off the blood flow to the diseased veins, and then that will help redirect the blood flow towards the healthier veins. And most oftentimes, again, there's no downtime from this procedure, and some of our patients even choose to go back to work the same day.
Wow, so you mentioned symptoms like pain, swelling, things like that in the legs. I would think that would be really difficult to deal with. Do those symptoms then get better with this treatment?
Yes, with this treatment and with some time to heal and everything, most of these symptoms do either completely go away or largely improve, so that patients notice that they're not having these issues, they have a better quality of life, they have better sleep afterwards, and just can do more things that they used to do.
Okay, well, I love the fact that we can do so many things these days to help people with medical advances. Thank you very much for sharing this morning.
All right, well,
Appreciate
thank you for having
your
us.
time. Thanks. For more information on this, if you're interested, if you know someone who may be interested, to schedule a consultation, go to txveinexperts.com.
What did your legs or feet feel like before you had treatments done with Texas Vein Experts?
Achy, fatigue. I couldn't wait to get home and put my feet up because they ached all the time, and I was always buying sole inserts for my shoes, thinking that would work, and 2 or 3 months later, the sole inserts were flat and I had to buy more, and so it was bad.
Yeah. And so since getting treatments on your legs, how do your feet feel now and your legs feel now?
Incredibly different. Well, the complete opposite. And it's neat because I had both legs done, but whenever I had one leg done and not the other one yet, I could tell the difference immediately just between those two legs. And I guess I got more time to do things in the evening because I'm not laying on the bed with my feet propped up.
Yep.
I'm here at Texas Vein Experts in Dallas, and I'm excited to introduce you to Dr. Scott Powell to tell us about this quick, easy procedure. Good morning to you.
Good morning.
Let's take me back to the beginning. Say I'm walking in for the first time and interested in doing a procedure. Walk me through that process. What does that look like?
Sure. So the first step is getting evaluated by one of our practitioners, which will also include an ultrasound or kind of Doppler test where we evaluate the veins in the legs and just look at how well they're functioning. It's painless, quick, easy to do, and usually the first visit's about a 30-minute process of, again, evaluating what problems you're having, what the issues are, and then getting that test to kind of further define the issue. From there, then we come up with a treatment plan, which you'll kind of know that day, and then we submit to insurance. Most insurances pay for this, including Medicare and Medicaid. And then once we have those approvals, then we can start setting up the treatment.
Okay, so what different types of procedures do you offer?
Sure. So the main procedure that we've been doing the longest is what's called radiofrequency ablation, or RFA, of the varicose veins. And doing that is essentially using a specialized catheter that kind of heats up and gets the vein to close down or seal. In addition to that, there's a newer technique using a almost super glue for the veins that does a similar process for the bigger veins. And then for some of the smaller veins and branch veins, we do various versions of what we call sclerotherapy, where we're using a medication to, again, get those veins to close down and disappear.
How do you know if you're a good candidate for this type of procedure?
So really, any person who's having leg pain, swelling, maybe discoloration, loss of hair for men in the legs, or just concerned that their legs just feel tired, heavy, achy at the end of the day, they're good to potentially be evaluated and may have issues going on with this. We also see sometimes that it plays roles in things like leg cramps or restless leg or even some degree of neuropathy.
All right, so what's the downtime after the procedure?
So most patients have light activity for 1 to 2 days after the procedure, but they go back to most full activity, work that same day or the next day with very minimal pain or really significant downtime.
All right, is this a one-time procedure? Are you kind of one and done?
Usually not one and done. Most of our patients require a series of procedures, usually spaced about a week apart, usually anywhere from about 3 to 6 procedures. But once that is completed, then 90% of them will never have anything else that they really need to have done. Occasionally, there may be a new branch or a new vein that comes up over time that may have to be retreated, but usually then it's a simpler process to get that fixed.
Why is now a good time to come and see you and consider this type of procedure?
Sure. So 2 things. One is right now we're at the end of the year, so a lot of patients have their deductibles met. They can get in, be seen, and still get this treatment done before the deductibles start back over in January. And another thing is we know that this is a progressive disease. So if you're having those symptoms, they're not going to get better on their own. The body doesn't fix itself. They're not going to go away. So getting it treated sooner can alleviate some of the worst problems down the road that are harder to fix.
All right, so now is the time.
Now is the time.
Thank you so much. We really do appreciate it, Dr.
You're welcome.
Powell.
Thank you.
Take care.
If you fix your legs.
If you fix your swollen legs, we can play and build memories. You can help me learn to swim.
If you fix your aching legs.
If you fix your legs.
If you fix your legs.
You can walk me down the aisle on my wedding day.
You can stand in my graduation.
If you fix your heavy legs.
You can make it to our ball games.
My recitals.
My concerts. If you fix your cramping legs.
We can sit and watch the sunset. We can walk. We can walk together holding hands. If you fix your painful legs. Painful legs.
If you let Texas vein experts fix your legs.
So how did your legs feel before you had treatments with Texas vein experts?
Well, they were swollen all the time. I had to wear compression hose every day. And the pain, there was a lot of pain, and it was just really awful because I have a lot of fluid.
Mm-hmm. And so what has changed since you've had treatments with Texas vein experts?
Oh, well, everything has changed. Pain, for one thing. I don't have to wear the compression hose anymore. My legs have gone down in size, and also my weight has gone down tremendously because of the fluid. I had so much fluid, and it released the fluid, and it helped pain. I have restless leg syndrome severely, and it helped that. And I've just been thrilled with it. I highly recommend it to everybody.